Treating ADHD with physical play and family therapy. What is ADHD? ADHD is Attention Deficit Hyperactivity Disorder. It is a neurodevelopment disorder that is associated with academic impairment. Did you know that ADHD is the most common neurodevelopmental disorder of childhood? Fast facts. Males are 3 times more likely to be diagnosed with ADHD. 6.4 million American children have been diagnosed with ADHD. Ages range from 4 to 17, and the average age of diagnosis tends to be 7 years old. What are some symptoms of ADHD? Symptoms include but are not limited to trouble staying focused in school or anywhere, excessive talking, frequently misplacing items such as homework, toys, books, etc., a quick temper, difficulty staying still, and difficulty remembering things or following instructions. It is very important to do research on ADHD and find the best methods for subsiding symptoms. Some treatment options may include medicine, such as pharmaceuticals, behavioral therapy, nature therapy, coaching, physical play, and more. Well, what is the best way to treat ADHD symptoms? It is hypothesized that physical play, along with family counseling, is the best approach for treating symptoms of ADHD. This is because it can increase levels of dopamine and create healthy connections within the brain. Participants. Participants should include children between the ages of 6 through 10 currently enrolled in a school in Virginia. They should be diagnosed with ADHD. Overall, there will be 200 students, both male and female, 50% each. Who will run the study? The study will be conducted by 50 therapists in Virginia. Each therapist will be assigned 4 students. The recruitment process. This can take place in school, therapy offices, churches, after-school programs, and more. It can also include siblings, family members, friends, peers, and members of clubs. Consent forms will be given to the parents stating that they give their permission for their child to voluntarily be involved in the study. If signed, this experiment may begin. The first measurement is the Diagnostic and Statistical Manual of Mental Disorders, the 5th edition. This is a test developed by the American Psychiatric Association used to diagnose ADHD. It has 2 main categories: inattention and hyperactivity/impulsivity. For children under 16 years old, in the inattention category, they must have 6 or more symptoms present for at least 6 months to be diagnosed with ADHD. Same goes for the hyperinactivity and impulsivity category. The second form of measurement will be the Functional Magnetic Resonance Imaging Machine, also known as the fMRI. It is a scan that permits the measurement of brain activity detected by blood flow. It indirectly shows which regions of the brain are active or inactive, and also can indirectly measure dopamine. This is due to dopamine causing active cells to consume more oxygen. Materials are fMRI machine, DSM-5 test, AFNI software, and toys. Participants will be required to take a DSM-5 ADHD test, fMRI scan, play outside for an hour, 1 day each week for 12 weeks, attend family therapy for once a week during a 12-week span, and receive another fMRI. For the fMRI procedure, a technician should be present to adjust machine settings and make sure everything is okay. Researchers should know about any allergies or major health problems participants have before starting the scan. Participants will be positioned on the movable table with coils placed around their heads. Next, the subjects will enter the magnet while the radiologist, technician, and researcher analyze the computer outside the room. Once testing is done, the researcher will inform the participant the exam is over. Physical play. Physical play must be outside. There are many things participants can do, such as running, playing ball, throwing frisbees, jumping rope, hopscotch, and so much more. The next step is family therapy. This must take place in person with therapists. The parents and/or caregivers should be present at every session. The goals of these sessions. The goals are to strengthen the familial relationships in a positive way. Therapists need to help families come up with plans or goals that will help them, family, work together towards a common goal. Procedure for researchers. After each week, researchers should track and document the behavior of the participants. The researchers will have a chart similar to the DSM-5 and should focus on how much the symptoms have occurred that week. Scoring ranges from very often, sometimes, not often, and never. There will be an additional section for comments about progress that week. Weekly reports should also come from teachers and parents. After the 12 weeks are up, researchers should compare fMRI scans before and after. They need to collect new information about behavior and report cards and then compare them. For the statistical analysis, a dependency test should be used. This is because it is a repeated measures design, so it uses the same group. This is perfect to test the before and after of participants. Implications. If results are positively affected, it can be implied that children will improve socially and behaviorally. They can also be a spike in academic progression for the children as a result of family counseling and physical play. Thank you.